guys, welcome back to Medical Coding with Blue. Today's episode is all about setting educational goals if you are in the health information industry for 2025. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so if you are a medical coder, a medical biller, a CDI, a lead medical coder, a coding supervisor, any of these things, this episode is for you. So right now, we are in the middle of November 2024. This is the best time to start thinking about what you want to do in 2025 as far as setting educational goals. When you are in the health information industry, you want to make sure that you are continuously educating yourself. And what I mean by that is, of course, staying on top of the updates for the guidelines and for coding and things like that. It's very important to stay up to date on those things, as well as the laws and any new legislation that comes out about the health information industry. It's very important to keep up to date on that. But when we want to advance in our careers as medical coders, what do we need to do? And what is it that we want to accomplish in our career? So right now you want to just take out a piece of paper and just think about what it is that you want to do. Now, if you are wanting to pursue a degree in health information or health information technology or health information management, you really need to consider why you want to pursue this degree. Because first of all, on the front end, it's a lot of money, especially if you're paying out of pocket, if you're getting a student loan, it's very expensive. And sometimes people erroneously think that if they have a degree, they're going to make more money being a medical coder. And this is not the case. Because with the degrees, whether you are pursuing an associate's degree or a bachelor's degree, the associate's degree in health information technology or the bachelor's degree in health information management, these are not designed to be medical coders. These folks are designed to be our leaders. That is their role. That is their purpose. That is what they're supposed to do. So while it's great that you want to continue your education, maybe that's not what you need to continue your education towards as far as getting that degree. The degree is if you want to be in a leadership position. If you are not wanting to be in a leadership position, leadership meaning that you are leading people or that you are becoming an educator, okay? Those are people who are our leaders. So if you are not wanting to do any of those things, if that's not what you want as far as your career-wise, you need to write down on your piece of paper what it is that you want to do. Do you want to be a better medical coder who is making more money, who commands more of a higher salary because of your knowledge base? That's how you make more money. A lot of people think that it's because of all the credentials that I have that I can make more money. No, that's 10% of it. It really is just 10% of it. It all goes back to what your knowledge base is. When I see people with a string of credentials and they're brand new to the industry, that's not somebody that I'm interested in hiring if I'm a hiring manager. I'm not going to hire that person because that person does not have the experience to go along with those credentials. Now, if you've been in the industry for a while and you have experience and you've racked up additional credentials, then that's something different. But if you are just starting out and you're thinking that, okay, well, I want to advance my education so that I can make more money, let's think about what it is that we need to improve on, right? So if you know that pathophysiology is not where you're strongest, that's where you need to write down on your piece of paper for your educational goals for 2025. You need to write down, take a pathophysiology class or work through a pathophysiology book. Not everything that you do when you're pursuing continuing education has to cost you on the front end, okay? Like I said, with the degrees, it's going to cost you a lot on the front end. But again, you can learn from books. That's the whole thing with health information and medical coding, is that we learn from books. And a lot of times people think that they can just, again, rack up these credentials and it's going to make them look good, it's going to make them worth more money. No, at the end of the day, it is your knowledge that is going to take you far. So again, if pathophysiology wasn't your strongest, or maybe when you're coding, if you're a coder now, and you say, well, one of the things that I'm getting dinged on when I'm dinged on is when I'm on my audits is I'm missing is that I'm picking up symptoms and I'm picking up diagnoses, and they're together. So again, pathophysiology is going to help you to better understand what symptoms means for different conditions and what is related. So sometimes focusing more on that can help you. All right. And again, pathophysiology is something you can learn online. You can look at all the videos. Crash Course is a number one channel on YouTube that I recommend for any learning you need to do. Crash Course is a wonderful, like, full service channel that they have everything. Okay, but pathophysiology is one of those things. You can also let your fingers do the walking and read different articles, and you'll find lots of different things. There's the Merck manual online that can help you as well. There's the public library that is also there. And a lot of times people don't think about that. We think about, okay, everything's online and, we could just order a book. Again, you don't have to spend money to learn. You just have to learn to do your research. And spending that time reading is really going to help you. Spending the time working through workbooks is also going to help you. If you want to get a pathophysiology workbook, you totally can. You can find those anywhere you find your books. And I don't have any recommendations right now, but that's the thing that you can do. That's one of those research things that can help you along the way. So if pathophysiology is one of those things that that you struggle with, make that an educational goal for next year. And again, if you are wanting to pursue a degree because you want to get into leadership, because you have been in the industry for a while and you say, well, Bleu, I want to move up and I want to move up into leadership and I want to get my associate's degree, or I want to go ahead and pursue that bachelor's degree. That's wonderful, because you know what the purpose of that degree is for. You're not trying to pursue that degree because you want to make more money. The money will follow naturally. This is where a lot of people get hung up and messed up, is they want to chase the money. So they think they have to put out all this money in order to get this money back later on. And then they find themselves not really enjoying what they do. They get resentful towards the industry, and it shows. You ever work around those people that they're really resentful towards the industry because this wasn't what they wanted to pursue? They wanted to pursue something else, but they saw that this was a good paying field and that kind of thing. So that's something that you guys have to think about. When we're working out these educational goals, this is something that we're going to be honest with ourselves, and we're going to be able to say, okay, well, maybe I was being a little greedy with wanting to pursue the money. But I have to understand that the money is going to come with time. It's going to come with experience. It is going to come with my knowledge. When I held my CCA, the Certified Coding Associate, I held it for 13 years. A lot of people tried to dismiss me because I had what was considered an entry-level credential. And I really wish they would change the advertising on that, because the CCA is a very difficult exam to pass. It says that you have that entry-level knowledge of not just inpatient coding, not just outpatient coding, but inpatient coding as well. Inpatient coding is a different animal altogether. It is a completely different beast. And because of that, that credential deserves a lot of respect. And for that reason, I held on to it as long as I could. I would still have it today if AHIMA let me, but they don't. But I will say this, when it comes to how did I change hearts and minds when it came to having that credential? You only had one credential, Bleu. How did you do it? I did it by investing in myself and investing in my education. And how did I do that? My educational path took me on attending conferences. Now, I talked last week about the value of attending the national conference for AHIMA. AAPC has theirs as well. But when it comes to AHIMA and their conferences, and I said that the average cost is $1,800 to attend. If you're going to pay for your ticket, fly in, and stay in the hotel, $1,800, okay? There's also state component association conferences throughout the year. So you just have to look in your state if you are going to sit for an AHIMA credential, or if you have an AHIMA credential, you might want to look and see, okay, well, in the different cities, they have their national their state component meetings and things like that. So there's lots of opportunity. And of course, it's just a few $100s. You can, attend these for like less than 500 usually. And that's the cost of your ticket, that's the hotel stay, because these are very short. But it gives you the opportunity to expand your horizons when it comes to education. Now, I find myself very educated since I have been attending all these conferences since 2014. Now, I have missed a few years because, of course, after the pandemic, I didn't attend until last year when it was Baltimore. That was my first conference back. And then, of course, I attended this year, and I spoke this year in Salt Lake, which was a wonderful experience. But I will say that investment of attending national conference has really helped me to develop as a strong medical coder. So that would be what I would put on my list if I was to do my list again about educational goals, would be to attend a conference. And if it's not the national conference, if you say, Blue, that's just too much money, it's fine. Then attend your state chapter conference. So that way you can start making those connections. You can start seeing what all is out there. And sometimes you may think, this stuff does not really refer to me in my situation right now, but it doesn't mean that you can't go in and listen. Okay, because when we're brand new, we don't know everything. And sometimes we don't know the questions to ask. And you never know if attending a conference, a class that you think is not really for you, you never know if that might inspire you to have your career goals next. What is your different career goals? So you never know unless you put yourself in that situation and you show up. Okay, so that would be one of the other things that I would recommend is if you are looking at your list of career goals, educational goals, is that you write down wanting to attend a conference. Okay, and these are just your goals. Okay, now goals you have to have a plan in order to meet these goals. It's just like going back to studying pathophysiology. If you know that that's something that you struggle on, how can you get there? Because yes, we're going to have this list of things that we want to do, but how do we get there? With pathophysiology, going to the public library, checking out a workbook about pathophysiology, so it's not costing us, okay? But it's going to make us a better coder, okay? Learning to access the Merck manual online, which is free. And again, that's also going to help you with pathophysiology. Now, when I first got into the industry and I learned about the Merck manual, I didn't really understand it. But the more you spend time with it, the better off you'll be, okay? So those are two things that we could do. Also, making that commitment to studying 20 hours per week. And if it takes 20 hours per week, and then you're studying over the course of 4 months, and you complete that workbook during that time, well, guess who's more advanced now? And not only that, you've just completed an educational goal that you had for yourself. So don't just write things down. Make a plan of how you're going to get there. So again, going to the public library, looking on YouTube and watching those pathophysiology books from Crash Course, Lord. Watching those pathophysiology videos from Crash Course, okay, and incorporating that into your learning, okay, and then again, looking at the Merck manual, that will also help you. Yes, there is the hardback version. You can get that from Amazon. You can get that from, Barnes & Noble, wherever you get your books. You can get any one of the Merck manuals, okay? There's a professional edition. That's fine. There's a home edition. That's also fine as well. But what you want to do is give yourself that exposure to pathophysiology. Now, with attending a conference, whether you are with AHIMA or AAPC, how do we get there? How do we get to this point of, okay, well, I want to attend the conference in Texas in the spring. Okay, well, then we know we have 4 months. 4 months. We know that we've got to look up the cost of the ticket. How much does the ticket cost to attend conference for the couple of days that it is, right? Is it the 2 or 3 days, something like that? And then we got to look up the cost of the hotel. We got to look up if you need to fly in, how much is that ticket going to be? And that, let's just say it's $600, okay? And let's just say it's in June, right? Which I don't think it's in June. It's either in the spring or in June. Something is in June in Texas. But anyway, think about it like this, okay? Now I know I have 6 months. I've got to save $100 in 6 months. That's, if you get paid every other week, we know we got to put $50 aside, okay? And that's going to be our $600 in 6 months. And you could start doing that now, because if you have that on your list for your educational goals for next year, you know already, okay, I've got to save $50 and I've got to save another $50. It's $100. And then in 6 months, I'll have $600 and I can attend conference. And it's not going to impact me. $50 is what? Going to Starbucks. $50 is what? Buying things on Amazon that are nonsense, okay? We all know we do it. We all know we do that. But this is an investment towards your education. And this is a small portion of what you have to do, okay? Which is get that discipline, all right? And so that's the other way that you can make that plan to be able to expand your educational efforts for next year, for 2025. And again, making that plan of, okay, I want to attend a conference. This is the month that it is. This is the cost of the ticket. This is the cost of the hotel. This is the cost of the travel to get there and get back. And so this is what I'm going to do. Also, if you're going to do that, you need to start talking to your employer. If you are employed as a medical coder, you can ask your employer if they have funds for you to attend conference. If they do, then you just saved yourself money. Okay. And not only that, it's exciting and it gets people motivated to want to go to these things so they can learn. That can save you money right there. But if they say, oh no, if you want to attend conference, you need to do that on your own. Okay, then that's all right. But you can ask them, can I get administrative leave for the days that I'm going to be at the conference? They may give you a travel day, they may not. Back in the day, I used to get a travel day. I don't get travel days anymore. They tell me, okay, Blue, when is the days of the conference? And that's all you get. Hey, you know what? I'm fine with that. I'm fine with that, because this is an investment in me. And there's a lot of people that get hung up with, I can't afford it. I can't do this. Guys, we can make efforts and we can make ways to do things that we want to do. Everything else is just an excuse. It is. And for those of you who say, well, Blue, that's just obnoxious for you to say, you can think that I'm obnoxious. You can think that I'm condescending. Some of you use that word and don't even know what it means. But, oh, that's condescending. Yeah, that was maybe a little bit. But the thing about it is, guys, when I tell you things, it's to help you. And for those of you who already have those preconceived notions, and then I say something that goes against what you preconceively thought of, then all of a sudden I'm the one who's wrong. No. I'm not the one who's wrong. I'm just telling you how it is and what to expect. And especially when it comes to your education, and especially when it comes to how you are going to get to that level of knowledge and education, things like that, those are things that I want you guys to think about. And these are things that you don't hear from other people, because other people, everything is a business for others, right? And while I do, my channel is monetized, of course, because I've been on this channel, on YouTube, long enough. That's not the whole point of it. The point of it is that my whole thing, again, that I don't try to sell y'all things, even though I do have services, but that's not what I'm hawking here. What I am hawking is the truth. And this is the reality of the situation, okay? Everything else will fall into line. It's just like how you are wanting to, get more educated and things like that. It will fall into line if you make the efforts and you do what you're supposed to do. For me, what I'm supposed to do is be here to tell you guys, this is the reality, this is the truth. It may not be what you want to hear. And I had a bunch of people telling me last week and the week before that, Blue, you told me what I didn't want to hear, but I needed to hear it. And sometimes we just have to do that. Sometimes we just have to, I feel like I have a hair on my face. Sometimes we just have to be told. We don't want to hear it, but somebody has to say it, okay? And I don't mind saying, the truth, and this is what it is, okay? So these educational goals can be met, but again, you just have to work with what you have, and let's see how we can make it. How can we make this goal a reality, okay? Now, if you're wanting to pursue the degrees, okay, you need to shop around for the degree that you want to get your degree from. You need to shop around, because there's a lot of education places out there, a lot of colleges and things like that. A lot of them charge different amounts of money. So you need to do your research, and you need to make sure that it is approved through CAHIM, that is the Commission on Accreditation for Health Informatics and Information Management. They're the ones that are going to say if this school that you are attending has an approved program, so that once you've completed that program, you can sit for the RHIT or the RHIA. If they don't allow for that at your school, if this is not an approved CAHIM program, then you're wasting money, because then you have a very expensive piece of paper. You know, in this industry, to be able to get to certain positions, you have to have the RHIT or the RHIA. And again, if that's where you're wanting to go, if you're wanting to get into those leadership positions, that's what you want to make sure that school is approved through. And don't just ask the recruiter for the school. You do your due diligence, and you get on that CAHIM website to make sure that that school is approved, and look to see who has a better deal on educational packages, because again, that's what's important. You are the one who's putting out the money for this. You can apply for scholarships. There's money out there to apply for these schools and things like that. So you make sure you take advantage of those. People who cry about, oh, I got into student loan debt. Did you even attempt to apply for scholarships? Did you even attempt it? Because that's where a lot of people, they want to cry victim, right? But they didn't do their part to make it easy for themselves. They didn't do their research. They didn't apply for scholarships. And these things are important because it's going to help you. And again, you are giving your time and your energy and your knowledge to this industry. And if there are scholarships out there that you can apply for them. Okay, to make it easier on yourself. And again, some of these schools are going to charge more money, and some of these schools are going to be very reasonable. So you go out there and you look and see which school is the best for what it is that you want to do. Okay, but again, you only want to pursue the degree if you want to be in a leadership position. All right, just pursue it if you want to get into those leadership positions, because again, if you're going to be spending all this money expecting to be a high-paid medical coder because you have a RHIA, that's not the way that it is. RHIAs are our leaders. They are the captain of the ship. They are the ones that are managing people, and they're managing the people who manage the people. All right? So that's what you need to know. It's not so that you can make more money. And getting additional credentials, I will say this on the additional credentials. It depends on the credential. And again, it depends on your level of experience. I don't recommend people getting into the industry to start off with the CDI credentials, any of those, the CCDS, CCDSO, or the CDIP. I don't recommend that. I recommend you get a medical coding credential first, because if you don't know a hill of beans about coding, what makes you think you're going to know anything about a CDI? And for those who say, well, Blue, it doesn't say that you need to have medical coding. No, it doesn't. A lot of these credentials don't say that. However, being in the industry and seeing what these people need to know, I say that it's very important that you have a medical coding certification before you pursue a CDI credential, because again, if the CDI is the one that's going to go in between the doctor and the medical coder. If that medical coder voices a concern to that CDI, and maybe the CDI is a nurse CDI, and the nurse CDI doesn't really understand what the coder is trying to say because they don't understand coding rules, but they're saying that the doctor says that this is okay, and they're trying to tell the medical coder, oh yes, this is fine, and the coder saying no because of this, and that third, and the CDI still doesn't understand. Guess what happens? There's a breakdown in communication, and there's not going to be that higher level of specificity like there should be, because that CDI doesn't understand coding. However, on the flip side, for those who have listened to me and have gotten their medical coding certification, then got their CDI, now they get it, they understand. Oh, okay, Blue, I get it. I get what the coder is trying to say. So now you have this synergy between the coder and the CDI, and then the CDI is able to explain this to the doctor. The doctor, okay, now they get it. Okay, so there's not that breakdown of only knowing half of the story. When you are a CDI, it is your responsibility to learn more about coding, so that way you can understand what the coders are asking, when they're saying, hey, we need the doctor to do this, or the doctor's not clear on this point, and things like that. Again, a CDI is going to have that clinical background, but a clinical background doesn't mean a hill of beans if you're trying to explain something about coding. I'm just saying. And you're having to explain things about coding to that provider. So do yourself a favor and make sure that you learn about coding first, okay? So again, if you are a nurse and you wanted to get into CDI, make that a 2025 goal of getting a medical coding certification. That should be on your educational list to do, okay? And even if you did it the backwards way and you said, okay, well, Blue, I already have my CDI credential and, but I want to get better and I want to learn more, then get a medical coding certification. It doesn't matter which one you get. Any one of these 4 main medical coding certifications, the CCA, the CCS, the CCSP, or the CPC. Any one of these, and you just need one. You don't need to double up and get all these other ones or be certified with AHIMA and APC. To me, that's just a waste of money, guys. You pick one. You just need to pick one. You don't need to be certified through both. Pick one, all right? It doesn't mean that you are any less intelligent. Again, your intelligence shows by your accuracy, and it shows by your knowledge of the guidelines. It shows with your knowledge of pathophysiology. But making that list, guys, that's what's gonna start you there. And once you start that list, even if it's 3 things that you want to accomplish education-wise for next year, make a plan on how to achieve each one of these. Whether it is that you have to find out how much whatever it is costs, or you have to go to the library, or you have to write down how much time you're going to put in, and it should be 20 hours per week anytime you're studying anything, because that's how you get to that mastery level of understanding on anything, is by making sure that you put in the time. People who only put in a lackadaisical amount of time, like 5 hours per week, and then they come up with excuses, or they say, well, it's because my family is this and that. No, guys, you will make time for the things that you want to do. You will make time for the things that are important to you. And so for 2025, let's make that a goal. It's to stop making excuses and to start putting in the time when we are trying to get educated. Because the more you're educated and the more that you break it down into digestible education, so that way you're not getting so overwhelmed. You're not getting to the point where you want to give it up, but you're getting to the point where you want to enjoy it. And how do you do that? Again, by setting digestible goals. If you want to set 3 educational goals, like to get better with pathophysiology, to attend a state conference or the national conference, okay? National conference, you're going to have to be spending a little bit more, but it's okay. And then, maybe working on an additional credential. Those are things that you can set, and these are things that can be manageable throughout the year. You have 12 months, all right? And you can get a jump on these educational goals for 2025. Write them down, post them somewhere that's a private area for you. Maybe you don't want to announce this to your family and your friends. Don't announce it to your friends. Your family may see it, but if this is something that's private for you, keep it somewhere where you can see it. All right, make this list and you make a plan on how you're going to get there to each one of these things. So that way you can achieve your goals, guys. That's the way you achieve your goals. That's how you get to a level of success that you want. But you're not going to get there by talking to other people about it, sharing your journey and sharing your goals and things like that, so that you can hear other people's bad influence. Because a lot of times people don't know how to turn other people off, like their negative words, or their negative words, or their non-belief in you. You need to believe in yourself, guys. If you believe in yourself that you can do something, trust me, that's more than half the battle right there. Is because that's all you need, is to be able to say that you can do it. Is it nice to have encouragement from other people? Absolutely. But don't go looking for it. Don't go looking for it, because you'll find yourself very disappointed. You will. But just make sure that when you are doing these things, you're doing them for you. You're doing them so that you can be more involved in what you're doing. You can understand it better. It's not going to be so frustrating for you. That's why you want to do it. But set those goals and then set the steps to achieve those goals so that way you can accomplish those goals in 2025. Okay, at least that's just my advice anyway. So with that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.